Washington County is well above the state average for population health and well-being. It is also slightly above the national average in those same categories as well. This is depicted in the graphic seen below. Currently, Washington County has an obesity rate of 33%, which is the third lowest percent within the state of Arkansas. The highest prevalence is seen within the Hispanic community, the second highest in African Americans, third the whites, and lastly Asian communities. The life expectancy within Washington County is 76.8 years. The median age within Washington County is 32.9 years. This is greater than the life expectancy within Arkansas, which is 73.7 years. But the life expectancy within Washington County is slightly less than the life expectancy within the United States, which is 77.1 years. Washington County reports that they have an average of 5 out of 30 poor physical health days. This is less than the state of Arkansas, but it is more than the United States. Arkansas reported 5.2 days, and the United States reported 3.9 days out of 30. It is found that Washington County does have a greater number of days of poor mental health compared to the United States, but they have less days compared to those within the state of Arkansas. So they are kind of in the middle with the United States and Arkansas. There are 244,871 people that live in Washington County. The minority of people are the American Indian and Alaska Natives, with 3,573 people. The majority of people are white or Caucasian. The English language is the majority language that is spoken within the home. 82% of people speak English within that home. And then Spanish is the second language that is mostly spoken within households within Washington County. Some health stats about Washington County. About 10% of births are considered preterm. So this is when births are prior to 30 weeks gestation. This can be to many different things, like high blood pressure, diabetes, lots of different things. 8% of babies born in Washington County are born underweight, so they are born under 5 pounds and 8 ounces. A lot of times these babies are put in the NICU and are feed and growers, so they are just put in the NICU to make sure that they are able to eat and grow and gain weight in a good amount of time prior to being sent home with mom. 18% of adults in Washington County are current smokers. 16% of adults in Washington County reported that they either binge drink or they are heavy alcohol drinkers. there were 7 deaths due to drug poisonings, 577 deaths due to heart disease, and 60 deaths due to stroke. In 2023, 87% of those living in Washington County had health insurance. In 2024, 87% of those in Washington County had health insurance. And then in 2025, 86% had health insurance, which is just a 1% decrease from the previous 2 years. These are those who are under the age of 65 and do not have Medicare. Within Washington County, there are currently 193 family practice or primary care physicians. So each physician would have to see 1,250 patients. There are currently 144 dentists. So each dentist has to see 1,590 patients. There are currently 71 psychologists. So each psychologist would have to see 230 patients, and I was honestly astounded by this number, just how low the amount of psychologists were. There were 451 social workers within the county, which helps make up for the lack of psychologists. There are 44 OB/GYNs within the county, and there were 76 pediatricians. There are currently 6 hospitals within Washington County. There is Washington Regional Medical Center, which is the largest hospital within Washington County. Northwest Health Physicians Specialty Hospital, the Veterans Healthcare Systems of the Ozark, which is the VA hospital. Northwest Medical Center, Willow Creek Women's Hospital. Arkansas Children's Northwest is a branch of ACH. And then Northwest Medical Center in Springdale.
What is the Affordable Care Act? The Affordable Care Act provides health care at little to no cost for those that are low income. It allows for the lower income population to get regular medical care and have health care equity. The Affordable Care Act is beneficial because more vulnerable individuals are getting treated without overbearing the lower income population with medical bills. Components of the Affordable Care Act that benefit Washington County. The helpful components of the Affordable Care Act include Medicaid expansion, which looks at the health equity and increases access. For Washington County, Medicaid expansion has implemented through a 2014 private option that was later known as AR Home. AR Home stands for Arkansas Health and Opportunity for Me. 17% of residents are living under poverty line. Affordable Care Act expands the health care access and allows for that 17% of residents to get the required health care they need. The benefit of health equity and access to health care. Uninsured rate of Arkansans went down from 16% in 2013 to about 8% in 2022. And the younger adults and rural populations were covered under this act. And for Washington County, we saw that there was a higher rise in preventative care and fewer emergency visits that overall just improved the health equity and health care in the income and racial subgroups and those that were a vulnerable population. Components of the Affordable Care Act that are hurting Washington County. So the expansion of Medicaid is leading to more demands on the healthcare services from the underserved population. There's less providers that are accommodating this interest in increase in demand, and there's one family care physician for about every 1,400 people. That leads to longer wait times, providers being overburdened, and hurting the underserved rural population because they're not able to see that provider. With the recent bill being passed, the big beautiful bill is going to hurt the Washington County's vulnerable population. This is because there will be less expansion to a certain population as there is an eligibility cutoff, and there are more stricter cutoffs. This gives rises in diseases, especially in the vulnerable populations, and that is because they're not able to be treated, and that's also going to hurt that equity in healthcare. There would be about 16 million people that would be uninsured and that are going to be affected by this bill being passed. This regresses the progress of the Affordable Care Act that has already been made currently. The impact of the Affordable Health Care Act on Washington County and its healthcare equity is that its lower reimbursement rates are making Medicaid patients not being able to be seen by specialists because they don't want to accept Medicaid because they're not getting paid for their service. Limits access to certain care and certain specialties. And these dynamics change healthcare equity and show that having insurance doesn't always mean that you're going to get the quality care fast, especially for those marginalized groups. The Affordable Care Act component, Section 1557, the non-discrimination rule. Something that wasn't discussed in class is a Section 1557, which is the non-discrimination rule. This rule prohibits discrimination in healthcare programs or places that receive federal funding and is based off race, sex, age, and if you are disabled. The importance of Section 1557 in Washington County. Section 1557 is important because there is a growing population of Hispanics and Latinos, and there's about 17 to 18% that have language barriers and possibly face implicit bias in healthcare, according to the U.S. Census Bureau. Section 1557 requires access to language services and includes interpreters and translating healthcare material so they can make sure that equal care is provided for all. Supporting clauses for transgender individuals and their rights to getting health care without being discriminated against is also provided in this section. There's also this is also critical for healthcare inclusivity for all Arkansans. Enforcing Section 1557 is varied, but its presence in the Affordable Care Act is a step towards having healthcare equity and being able to protect the vulnerable populations of Washington County and all of Arkansas.
For part 3 of this project, we are addressing a need within Washington County and creating a program to fix this need. So the need I would like to address is the scarcity of providers in Washington County. So this is especially important for this region as it is largely surrounded by other rural parts. Whether it's Oklahoma, whether it's Missouri, there's a lot of rural areas within or just outside of Washington County, which makes Washington County a hub for a lot of acute traumas, like level 2 traumas, or any other accidents that occur. These people get brought into this county, and that is where they receive their healthcare and emergency care. So because of this, it's especially important that we have enough providers, both to meet the people that live there at all times and to meet the needs of people that live within surrounding rural areas. As of right now, there is a scarcity of providers, and I suggest fixing this by increasing the amount of residency spots within the region. So this is actually a program that is being or a problem, I should say, that's being addressed, and it's being addressed by the Graduate Medical Education Residency Expansion Board, which was created in 2019. This has provided funding for more spots. Since 2021, they've added 50 spots in total, 24 of which are internal medicine, the remaining of which are in family medicine. So this has significantly improved the capacity for residency training in Northwest Arkansas, but I think this is especially important that we continue to expand it for a number of reasons, which I will get into as we go. I would especially like to see an increase in the amount of emergency medicine spots in the region, as this is something that is non-existent, and the only emergency medicine programs are located in the central regions. As we all know, as the population grows and as insurance access improves, whether through Medicaid expansion or other programs, it's extremely important that we have enough providers to support these needs. And doing so takes a long time. So it's important that we start this progress early. So one of the reasons I think this is especially important and is also such an achievable metric is because right now there are less residency spots than there are medical school graduates. So this means that every year there are a number of students, a significant number of students, last year I believe it was about 65, that graduate from a medical school in Arkansas, but are required to go out of state for residency because there are not enough programs. So this is assuming that every person that went to a medical school in Arkansas wanted to stay in Arkansas and did so. But if they did, there would still be about 60 students that do not match and cannot get their next training within the state. So there is a need for more residency spots, and this is an even growing need because this year the Alice Walton School of Medicine is opening in Northwest Arkansas in Bentonville. This is within Washington County. When this opens, there's going to be 48 more students on top of this that there are not enough residency spots for. So we have the amount of trained students who are ready to take these jobs and fill these programs, but we just simply don't have the training in place, which is why it's especially important that we build it. So to get into a little more of the nitty-gritty for this program, some of the stakeholders that would be involved are local hospitals like Washington Regional, which is the biggest within the region, Mercy Springdale Northwest, which includes locations in Bentonville, Springdale, and Rogers. So these are the hospitals. There may even be some additional ones that would need to be looped in. Other stakeholders would be current medical schools, as this will apply to the students and future residents. It would also need to involve current Arkansas residency directors, potentially in the fields that would be added, such as emergency medicine, family medicine, or internal medicine, as these are the people who are most familiar with how current residency programs operate and could assist in building up and creating a successful next program. We would also need to involve the state government, as these are the people who fund residency spots in Arkansas. We would need to include the faculty of hospitals responsible for training. So every resident works directly with attending physicians. So all of these attending physicians would need to be looped in on the process and well trained to also educate residents and not just do their job, but also have a key part of the education and academic process. And then the final stakeholder in this case would be the ACGME, which is the National Accreditation Agency responsible for accrediting residency programs. So my first plan of action would be to create focus groups that involve all of these stakeholders to discuss the potential of creating more residency spots and to find out the next steps to do so. It's likely going to be to secure funding, as these are the most critical things when it comes down to building these programs is ensuring that we could actually have the money and resources to have new residents and build a new program. After that, it would be important to appoint roles for the necessary positions, such as the residency directors, ensuring that the program is accredited and receives accreditation after a number of years, and also just ensuring that there is boards and attendings that oversee each of the residents. And then, as one may expect, there's always conflict with any new program. So as conflict arises, I think it's important to create common goals and remind one another of the common goals, as at the end of the day, we're simply trying to improve healthcare in Arkansas. And how we do that can be done in a variety of different ways, so people are not necessarily right or wrong in how they want to do it. It's important to use a mediator when doing these things. So whether that mediator is going to be maybe another physician, maybe it's a third party that is not linked to the hospital system, or maybe they're not linked to the health policy, as all of those things maybe can be a little contentious and political. So use someone outside to mediate and provide their thoughts. And then also make clear documentation for expectations and things that you've agreed upon. This will establish clear goals and also ensure that there's longevity and transparency as the program's built up.